U.S. Health Secretary Robert F. Kennedy Jr. has fired all 17 members of the Vaccine Advisory Panel for the Center for Disease Control. ACIP is what it's known. The panel of experts is the one that recommends how the federal government responds, who gets vaccines. This is the organization that has shaped the federal government's vaccines policies and recommendations for years. And he made the announcement in an op-ed published in the Wall Street Journal yesterday, a move that he says has been needed to reestablish public confidence in vaccine science. All of the members of the advisory committee were appointed under former President Joe Biden. This clears the way for Kennedy and the Trump administration to install their own picks, which will be covering. We haven't heard any names yet, but the committee is set to meet again in the coming days. But this has attracted a lot of attention in the United States among public health experts, and it certainly has caught the attention of Dr. Isaac Bogoch, who's with me this morning, infectious diseases specialist at Toronto General Hospital. Good morning, Dr. Bogoch.
Good morning. Great to see you.
Great to see you, too, and I'm really very interested in your expert view on all of this. I gave a little bit of a headline, but can you explain this advisory committee and what it does?
Yeah, absolutely. This is known as ACIP, ACIP, the Advisory Committee on Immunization Practices. It is basically the American equivalent of NACI, the National Advisory Committee on Immunization. That's what we have in Canada. This is an independent, non-governmental group, and it provides independent advice in the United States, to the CDC, in Canada, to the Public Health Agency of Canada. It's composed of vaccine experts, and that can be from a variety of fields: public health specialists, immunologists, infectious disease providers, social scientists. You know, it's a pretty interdisciplinary group of people who can provide sound advice to a governmental organization in terms of, what do we need to do with vaccines, really the nuts and bolts. So who should get which vaccine, at what age, what's the schedule, what does the safety profile look like, what are the benefits? And again, I think that the beauty of these organizations is that, the goal is to provide sound, scientific, data-driven vaccination advice. And in doing so, in an open and transparent manner, you can build trust among the communities that you're working with. And obviously in the ACIP's scenario, the United States and Canada scenario, the population of Canada. And these people who are on these committees don't have conflicts of interest, or if they are,
and yet,
any conflicts
it's
of interest,
interesting.
it's very... Yeah.
That's been the basis for Robert F. Kennedy's claims, that it's rife with conflicts of interest, and this is going to improve transparency and, his view, restore the public's trust in vaccines. What do you think?
Well, I mean, obviously, if there are conflicts of interest, they have to be very public and transparent about it. But the whole goal is sound advice, data-driven advice, scientific advice from an expert panel. And, if you take these unilateral moves by just removing everybody and then appointing, who knows, other people, we have to know what the process is. Who's going to take their place? Will there even be an ACIP? How will the new members be appointed? And you can't. The process is important in situations like this. Otherwise, you significantly erode trust by eroding transparency and eliminating expertise. And this is something that you obviously need tremendous public trust to have public buy-in with any public health initiatives, especially vaccination.
It's interesting, the reaction, as I said, within the U.S. public health system, it's been pretty strong. I mean, the words that have been used: extreme and reckless, shocking and unsurprising, brazen, short-sighted, severely harmful. What are the concerns? I mean, we know Robert F. Kennedy's background and the concerns that he's raised and his lack of belief in vaccine science. So what could change, and what are the concerns that this raises for you?
Well, there's a couple of things. Number one is that it has the potential to significantly erode trust in the United States. And you see a greater resurgence of vaccine preventable illnesses because perhaps people aren't going to be using products that have already been deemed through decades and decades of data to be very effective and with a well-established safety profile. So that's number one. Number two is that nothing happens in a vacuum. We're obviously well into the information or maybe even misinformation era, unfortunately, and nothing happens in a vacuum. So people look at the United States as well from all over the world, and some of the sentiment, positive and negative, regardless, is going to bleed over into other places. In a case like this, it's not clear what the process is going to be. There's certainly the potential for mistrust and negative consequences elsewhere on the planet. But the third thing, and I think importantly, is with issues like this come great opportunities. And this is an opportunity for Canada to lead. We already have a sound, independent, data-driven vaccine advisory group. We have NACI. They do a remarkable job. And Canada can be the global leader on this front. And we can certainly elevate the status of NACI and showcase NACI to the rest of the world and say, hey, you know what? We have the expertise here in Canada. We are doing this. We are independent, a non-governmental group that advises government. Here's our website. Here's our processes. And again, it's all very clear for the general public to see around the world. They have a updated webpage with summaries and then nuanced advice. And we can certainly showcase Canadian talent to the rest of the world and be a global leader on this front.
So potentially a positive for Canada in all of this. But as far as the negative, I'm concerned about consequences because we've already seen from the Trump administration under Robert F. Kennedy Jr., they've changed the immunization requirements for COVID vaccines, reducing the availability. So it's now 65 and older, anybody with certain underlying conditions and otherwise no. So the concern is, as I understand it, continuing reducing the availability and the access of vaccines generally to the American public. And what would be worrisome in that and potentially worrisome for us in Canada too?
I want to be very careful here too. The goal is obviously build public trust, ensure that there's sound policy, ensure that people have trust and faith in your public health institutions, and prevent illness. That's the goal. Pretty straightforward. A step like this certainly has the ability to reduce public trust and reduce rates of vaccinations with vaccines that are tested and have decades of safety and effectiveness data. So there's certainly the potential for that. They have said things that I think are very reasonable as well, but we've got to be careful because we have to look at the totality of what's been said. Some people were pushing back against doing clinical trials for vaccines, like COVID vaccines. And I think personally, you can line up 10 people and you might get 10 different opinions. I think that's a very reasonable thing to do in an era of widespread community level immunity through infection and through and recovery plus vaccination. We absolutely should have better data to guide some of the vaccine recommendations moving forward. That's a very reasonable thing to do. Having said that, this approach here by just gutting ACIP and then replacing it with who knows and through what processes, it obviously is concerning because, are you blending too much ideology at the expense of science, data, and you have the potential to erode trust doing something like that.
Dr. Bogoch, always appreciate your wisdom. Thanks for the time today. As you set out, Toronto General Hospital, that's Dr. Isaac Bogoch this morning. And this is CBC Morning Live.